One of the most important things to me as we go through the diagnostic phase of all of these treatments is to try to have the ability to measure as many things as we possibly can. I really believe if you can measure it, it's much more of a fact. If I can't measure it, it becomes much more of an opinion. So we really try to stay as objective as we can. So we use lots of technologies for this. One of the technologies that we really like is a T-scan bite analysis. And for years, we've all been to the dentist, had the dentist put the paper in your mouth and you bite down and you tap, and they adjust based on those marks. And what we find with the T-scan is that a lot of times we're actually adjusting the wrong places. So T-scan is a computerized bite analysis. So as you bite into it, it can sense where you touch first, not only when you touch first, but also how much pressure you are. So as we go through the adjustment phase of the diagnostic orthotics, we can now fine-tune that in so that all of your teeth that are supposed to hit at the exact same time with the exact same amount of pressure, so that the forces of your bite are perfectly centered, left to right, front to back. It eliminates most of those muscle contraction issues that then can lead to headaches and temporomandibular joint pain and facial pain and those kind of things. Another one of the diagnostics tools that is really valuable is the three-dimensional radiograph systems that we use. By looking at things in 3D, we are not only looking at the teeth, we can measure things like joint position, we can look for fluids in the sinuses, we get to look at a three-dimensional view of your airway. So we're not guessing as we go through treatment. Regards to the airway, we're able to see where your airway was initially in 3D, and then also after treatment, and then even through the diagnostic phases, so that we can confirm through measurement that we're actually having a positive impact on your airway and your ability to breathe. Also, it shows us little things like tongue position. And it's something that we never think about, but our tongue should be on the roof of our mouth 90% of our day, lips sealed, and breathing through our nose. So we're able to assess patients' tongue position, breathing patterns, and things like that through that three-dimensional radiograph. I really believe that having technology and being able to utilize that technology allows us to measure things initially, follow them during treatment, and see the improvements we've had at the end of treatment. And they're measurable, objective things, so there's not really a lot of argument on whether or not we've had a positive impact on our patients when we complete treatments.